The Australian team was given access to the medical files of more than 5,000 addicts treated in Israel during the past 4 years. They witnessed procedures performed on almost a dozen Aussies.
Which basically gives a person freedom from opiate dependence at the end of the procedure, which they can maintain if they maintain a tablet a day, and which if they don't want to stay free of opiates, they can consciously and in their own mind decide not to and relapse to drug use of their own volition.
Even death threats against Andre Waismann himself couldn't stop this historic medical lesson. If the Australian medicos came here looking for a new weapon in our arsenal against heroin, their prayers were answered. The government has now agreed to allow these doctors to soon treat an Australian patient.
It's been superb. We've seen patients before, we've seen patients after the treatment. We know a lot of the technicalities that we need to introduce it safely into Australia. We've seen patients on methadone, we've seen patients on heroin. We saw one guy who'd been on heroin for 25 years, and we've followed them through this procedure. So we now believe we can introduce this safely into Australia.
Is it magic?
No, there's no magic in this. It's just very, very good medicine. It's extremely high tech, it's very, very detailed, it's labour intensive for a brief period during the period when the patient's asleep. There's no magic, it's just very clever use of everything that we know. Good use of drugs, good use of anaesthetics. It's just fantastic.
Did you make a career decision to come here?
No, I don't think so. I think anyone who goes to look at good medicine cannot fail to be impressed with what we've seen. We have seen good medicine. Any doctor who goes and sees something which increases what they know and improves their medicine never takes a risk.
You're looking at the treatment for the first time. You're feet from it, inches from it. Describe for me what you're feeling, what you're thinking when you see all this happen around you.
Well, the first thing which strikes you is the level of severity, if you like, of the patients who are being treated. I mean, we're talking about people who've had long-term heroin use or long-term methadone. We're talking about people who've failed 5 or 10 previous detox attempts. We're talking about people who are very, very deeply into the effects of opiate addiction. The next thing is we have seen absolutely pristine medicine. I can't emphasize this enough. There is nothing quackery and there's nothing magic. It's just extremely skillful medicine done extremely well with the utmost attention to detail. And this is the thing which, in walking through the procedure, it's quiet, it's calm, nothing is rushed. There's no drama at all. In fact, from somebody looking for drama, it's almost disappointing. It just happens. But the team doing it has a rhythm, a quietness about them as they do it, which is really striking, as they're using very, very high-tech techniques to deliver this drug naltrexone, which blocks the receptors, to remove the effects of this in terms of the patient's consciousness and withdrawal side effects. And then the patients wake up. They don't wake up without any symptoms at all, but the major symptoms they have are those of having had the procedure, a general anaesthetic. They're not the symptoms of massive withdrawal. The other extraordinary thing to us was, for a number of patients, the clarity with which they wake up, the difference in their feelings, in particular, and I think this is one of the most important things, the extraordinary way they wake up without craving for the drug. And this is, as they say, each of them, this is different from any detox they've ever had. Waismann made technical sense. Everything I read about and in speaking to him made sense. But it could have been a con job. It could have been something being hidden. But we have spent a week with not a single thing hidden from us. We have seen this from top to bottom. We've spoken to every technician. We've viewed the medical records. We've spoken to the patients. There was nothing hidden from us. There are no franchises in this. There is no hidden agenda. There is no confidentiality agreements. This is pure medicine delivered by a person who believes in it to us. It is a gift from Israel to Australia, and this is really important. It's free.